Anita. Welcome, welcome, welcome. I was
Thank you.
just saying to everybody, we are a digital health platform bringing science-backed, evidence-based menopause hormonal solutions direct to your door. Today, I am very pleased to welcome Anita Nicholson, who I'm going to introduce to you all now. Anita is a board certified family nurse practitioner with 30 years in healthcare. Her experience includes hospital medicine, cardiothoracic surgery, as well as integrative medicine and women's health. She's committed to empowering women to take charge of their health and to promoting a culture of respect and excellence in the healthcare industry. Anita is a member of the American Association of Nurse Practitioners, American College of Cardiology, American College of Obstetrics and Gynecological Association, the National Association of Nurse Practitioners and Women's Health, the International Society for the Study of Women's Sexual Health, that is ISWISH, the International Menopause Society, the Menopause Society, and the National Center for Integrative Primary Care. Welcome to the Ally platform, Anita.
Thank
I've
you
been
for having me here. I'm
Oh,
so
it's such a
excited.
pleasure. For those of you who haven't yet met Anita, I first saw her in an interview with Dr. Louise Newson, and she was talking just with fervor and urgency about women's health. And I thought, who is that? Who is that masked woman? And how do I get her to
Yeah.
fly over my town and
Yeah.
make everything better? How are you today?
So great. So happy to be here. Thank
Thank
you.
you. Thank you.
Yeah.
So today we're speaking about perimenopause still, as it is getting to the end of Perimenopause Awareness Month, but it's also Sexual Health Awareness Month. And Anita and I connected prior to this conversation, and she really wanted to sort of dive deep into pleasure, sexual health, perimenopause, and how the three conflate.
Yeah.
So, if you would just kind of set the stage for us and tell us what perimenopause is, Anita.
Sure. I mean, if any of your followers saw your earlier lives from this week, both of them were like
Oh,
chef's kiss.
oh,
So good.
thank you,
So
thank you.
good. I think Dr. Mandelberg did a phenomenal job of
Yeah,
really diving into the biology of perimenopause, right?
yeah,
And a period of time where when we're younger and we start our period, ovulation is pretty regular. You have regular periods, and your hormones follow a fairly predictable, they're low, they're high, they're low, and we go around again. And then the next time they're really predictable is when all the eggs have left the baskets, the ovary, and then they're predictably low, steady, steady. It's a lovely place to be. The
mm,
in between is the hardest.
sure.
The perimenopause is the hardest because your hormones will peak and trough and peak and trough unpredictably, and so women know right away wrong. Like, what? I know how I feel 4 days before I ovulate and 4 days after I ovulate and 3 days before I start my period. And I know how I feel. This is all over the place. And it is. It's all over the place.
Right.
So perimenopause is the time when your period is irregular. We don't have a great definition for that, you know, and it goes really until technically you're in menopause, which most of the word on the street is 1 year after your last bleed, which makes sense if you bleed, but not
Mm,
if you uterus. And you can't really tack an age to it. I mean, average women who have ovaries and it's natural, maybe 51, 52, but you could have had surgical menopause. You could have chemical menopause, things that stop your ovaries from releasing eggs. So we loosely have an idea of those phases. The hardest is the perimenopause. Once
by far.
past that, honestly, it's really hard to convince women of this because they're terrified of menopause. But once you're past the irregular, like, you release an egg and then, oh, no, never mind, have another one. And then you have two periods and then you have no periods.
Right.
And, that's sort of just like all over the place. Once you are all done with that and you're not having that irregularity and you can just hormone replace yourself and stay steady.
Yeah.
It's lovely.
You know, I'm
So
so
good.
glad. I'm so glad for perimenopause, what is now September known as Perimenopause Awareness Month, because it really is providing so many of us opportunity to clarify that the worst of it really is perimenopause. Like, there can be stuff going on in menopause, absolutely. But when we're talking about primary symptoms, severity of symptoms, typically what we mean to be talking about are those years of perimenopause. But Anita, talk to us about sort of perimenopause, how it affects women, particularly as it relates to their sexual health.
Sure. There's biological things that are happening. So physically things are changing your body and you should connect with a provider that can help you biologically figure out if you're having vaginal dryness, treat it. If you're having joint pain, treat, like make sure physically in your body you are healthy.
Right.
Which also means you have to nourish yourself well, you have enough sleep and you have to do those things.
Yeah, for
So
sure.
there's physically taking care of yourself. And all of those things can be very difficult to do when your hormones are all over the place. If you're not sleeping well, or you are very fatigued because you're not sleeping well, and then you're not going to the gym, and then you're not getting your stress relief because your stress relief comes from exercise. You know, so they sort of domino into each other. So there's like the physical aspect of it, and then there's like how mentally well are you? Right? Like, what are you doing for your mental wellness? Because this is a period of time in a woman's life. Many women who come to see me in their like early 40s. Okay. So they're potentially, if we talk about a heterosexual relationship, cisborn male, cisborn female, kind of that relationship, that woman might be trying to peak in her career, right? She may have had 2 or 3 kids, trying to get them through middle school / high school ish. And women do bear 80% of the domestic burden of their lives, right?
Right.
So this is an absolute exhausting thing to do. It is going to
Yeah.
test you to your limits of exhaustion, mental exhaustion, physical exhaustion. So what are you doing during that period of time to mentally stay well? You got to work
So,
on
so, so talk to us about that more, because when you and I got to sort of pregame for this
it.
conversation, we were talking about pleasure, and you were really, really interested in amplifying for women, for your patients who come to see you in particular, this idea of where is pleasure lost, where is joy lost.
Mm-hmm.
There's the sexual wellness part, which we're going to get into more, but there is this sort of joy in the room that may be lacking that you were particularly
Yes. I
felt.
have so many women come to me and say, my libido is gone. Like, it's
Yeah.
gone. Like, I don't know if it's on a satellite circling the moon or what it is, but it's
Right.
not
It's gone.
here. It is not
Yeah.
here.
Yeah.
And it's distressing. And they feel like there's something wrong with them. Like, something must be wrong. Can you like check inside me and see, like, is there a flipping a switch is going to work, or what? Like, do I need to replace something? Like, what do I need to do? And often in a relationship, the person who has a lower libido, desire, however you want to couch that, is often portrayed as the one that needs to fix themselves, right? So you have desire at different levels. And if one person has a high, desire or libido, and the other person is like here, but this person is like, I'd like to have that twice a day. And the other like, yeah, but twice a week is good for me. So like, it's always going to be a little bit different, but this person seems to have to come up to here.
Mm-hmm.
Right.
Mm-hmm.
So that's not realistic or fair either. So you have to have a really good conversation about that. But for these women, I talk about what's getting in the way of your pleasure. What is putting the brakes on your pleasure? And you have to really be intentional about this, because there are a lot of things that are putting the brakes on it. It's not gone. It's still, you're still in there, right?
Mm-hmm.
You're not 20 anymore. Okay. You potentially grew a couple of kids inside of you. You're trying to raise them. You know, you're doing all of these things eating for your attention and your care. If you have lost track of taking care of yourself, you are going to lose track of your pleasure. And the only person that can get that back for you is you.
So when I hear you say that, Anita, I think about sort of the physicality of us, like someone's saying here, dryness that leads to pain, that gets in the way, right?
Yeah,
So that there's what's happening sort of in our bodies biologically because of our fluctuating
yeah.
hormones. And then there's sort of the piggyback, or, you know, the other silo of what's happening in our lives. So can you take us through what's happening to the physical part of us?
Sure. When our hormones are fluctuating, you can get vaginal dryness. Okay. And that will cause pain. It's very uncomfortable. It's very uncomfortable walking around with
Mm-hmm.
dryness, never mind trying to be intimate. And if it feels like razor blades with penetration, there's micro tears happening, it's higher risk for infection. It's incredibly pain is going to shut your orgasm off.
Mm-hmm.
Done. And you remember a painful experience. So now you're training your brain. If you go ahead and do it for your partner because you don't want to lose your partner, now you're creating this neuroplasticity
Right.
of, I
Right.
this thing, it's painful, I don't like it, right?
Right.
Addressing pain immediately. I mean, one of the first best things to do is vaginal estrogen if that's what's going on.
Okay.
And a vaginal moisturizer and lubrication every time, always. Everybody has a better orgasm. And there's
Okay.
no like, I'm too young for a lubrication that makes me sound like an old, like, no, no, no. No, that just makes your orgasm better.
Right.
Why wouldn't you want to do that? Yeah.
So there's several people talking about pain. So for someone who might walk into your office and say, listen, I'm having physical pain during intercourse. It tenses me up. It stresses me out. My mind body connection is done. I don't even want to do this.
Mhm.
Where do you start to kind of lay out help for
Yeah.
her?
There's a lot of different things to do. So first of all is you have to do a physical assessment, right? We need to see, is there something else going on other than, you know, I shouldn't just say other than easily treating low hormones. There could be something else going on. There could be an infection. There could be something else going on. So we need to sort of like rule that out, and let's do that because that's a different talk. So this is due to low estrogen or
Mm-hmm.
hormones, which you can have happen when you're nursing a baby.
Mm-hmm.
You can have happen through perimenopause when your estrogen is very low and it stays low before you start your period. You can have hot flashes, night sweats, dry vagina, like all the things. And then you get an egg and your estrogen goes up again. So it can happen in other times than just when you're in menopause. And if you're feeling that, you can replace the estrogen very safely. Vaginal estrogen is safe for almost everybody under the sun. It's easy to use. It doesn't get into your bloodstream, and it helps the cells in your vulva and your vagina stay healthy. Healthy, lubricated, sensitive equals joyful, wonderful orgasm. Like,
Yeah.
and it works. Like it
Right.
works.
Right.
I,
Right.
I,
Right.
like 95% of the
Yeah.
time, it
Yeah.
works. So
Yeah.
that's the first thing. If you have this history of, I did this, I had sex, it was very painful, I've sort of shut myself down, I'm tensing up. There's two different things to do for that. I love to send people for pelvic
Mhm.
health.
Yes, I saw somebody commented
Yes.
pelvic floor therapy, PT therapy for the win.
Yeah.
Yeah.
Yes. Do that. Because you're going to learn a lot about the muscles in your pelvis, when they're tensing up, what it feels like, how to relax them, how to be very strong and healthy in your pelvis. Definitely do that. And then the next thing to do is ease into it. Don't jump into penetration. Intimacy,
Talk to us about that.
intimacy is so much more than penetration. If penetration was painful for you, share intimacy that doesn't include penetration. everybody can still have an orgasm.
Okay.
So take it off the table. If that is what's like, oh, eventually this is, and it's going to be pain, then don't.
Right.
And get very vocal and get very okay saying, I want to be intimate with you. I want to share intimacy. I want us to share orgasm. I don't want penetration right now. Until I know I'm healed and I feel confident it won't be painful, let's do other things. What does that look like?
Okay.
That might be the spark that gets your whole sex life back in gear.
Mm-hmm.
We'll do
Mm-hmm.
this. Well, how about that?
Mm-hmm.
You know, and now all of a sudden you're talking about, well, that's kind of erotic.
Yeah.
We've never tried.
Yeah. Yes. Yes.
You know, and then
Yeah.
you really, and then eventually you work your way up to penetration if that feels good. But don't just jump right back in there.
Yeah. Somebody commented, quickies in the parking lot or an in-laws closet is out the door.
Oh yeah, that's so when you were 20-ish, you know, you have that spontaneous desire. There's really nothing putting the brakes on that. You know, you don't have these gigantic responsibilities you have right now. Your body hasn't gone through the changes of many kids, or just even if you didn't have children, the years of your life carrying on. And you're in a domestic partnership, maybe. You're not that body anymore. You're not that mind anymore. You're not that heart or that soul anymore. And for women, intimacy is very much connected to those things.
Yeah.
So now we have more responsive desire. Okay. And responsive desire is more like, you're not like, oh, I got 5 minutes, let's go. It's more, you know what, you should probably like sexy text me for a whole day before.
Sexy taxi.
Sexy text, you know, let's plan it for Friday. You drop the kids off to your parents. I'm going to do whatever I'm going to, you know, and you plan it and you work up to it, and whatever makes sense in your mind about what you have to transition from mom, from your job, from your being a spouse to being a sexual being and partner. You have to transition yourself, and you need to know how you do that, right? You need to know how to get into that space for yourself. Your partner can't do that for you. You own your own orgasm.
Yes.
You own
Do.
your job. Your orgasm.
What do you mean when you say that, Anita? That's a big statement.
So I have lots of women who will come to me and say, there's something really wrong. I can't orgasm with my partner. You know, and I have to try to figure out, like, is it a functional thing, like, or is it a relationship thing? And I say, well, how do you do on your own? And they go, oh, great, no problem. I'm like, okay, well, that's really good information.
That's really good information. Yeah.
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 Because
and
now it's communication with your partner. So whatever you're doing is not stimulating you in a way that is meeting your needs. And how do you then change how you're relating to your partner in a way that you can communicate that? Do you feel okay asking for what you want? Do you feel okay asking for what you need? You can't assume your partner is going to know how to make you orgasm every single time. I mean, you get to know each other, but that's like yes, no, faster, slower, more, like, you know, that's still communication.
right.
Still communication. And so you have to know what you want, what you need, what your desires are, share them, what works for your body. And what worked for your body 20 years ago may not work for your body now.
Yeah.
But something else does.
Yeah.
So get
Yeah.
curious about what that is.
Yes.
And then your partner. Be so curious and be so compassionate with yourself. You know, this body is, there's pleasure everywhere. There's sexual pleasure, there's, you know, sensual pleasure. If you live a pleasure-filled life, your morning coffee can be pleasurable.
Mm-hmm.
It's not going to be orgasmic, but, you know, it's going to be pleasurable, right? If you're looking for pleasure.
So, Anita, a couple of things I want to ask you as I'm listening to you. One is this point of sort of what's normal. And again, I keep in my mind, sort of bringing this back to someone who may or may not realize yet that she's in perimenopause. And
Mm-hmm.
maybe her libido is dropping, but she's not having vaginal pain. She's not having issues there. So physically, she's feeling like okay,
Yep.
but her libido is just declining. And so there's this idea of what's normal that I'd love for you to speak to. And then, well, I'll ask you my second question
Okay,
after, but can you unpack what's normal, what's
sure.
not?
I don't think there's a normal.
Mm-hmm.
Normal is what's normal for you. And if there's a delta and it's distressing for you, then we should address it. And that will be different for every single person. You
Yeah.
know, so if a woman comes in and says, I mean, I used to have a good libido, I don't anymore. Like I really, like my partner said, like it's been 2 weeks, and I'm like, are you sure?
Mm-hmm.
It's
Mm-hmm.
not days, like, oh, that's very stressful for me, but it's not on my mind at all. Then we have to look into, why is it not on your mind?
Right.
What are the things that are putting the brakes on your sensuality, your sexuality, and your enjoyment of pleasure? And then you got to sort of like dig into what's putting the brakes on, and also what would hit the gasoline, right? So maybe you're a words of affirmation person, and you're just realizing at this time in your life you want someone to talk dirty to you.
Mm-hmm.
I don't know if words of affirmation are important to you, what you hear matters. Maybe that is something to add into your life. If you have a lot of things that are, especially the mother role, and you might now be mothering your spouse, which is very difficult to get into a place of, and now I want to get married with you.
Yes. Yeah.
I,
Yes.
that is a hard stop. Another hard stop is, and I find this in a lot of my patients, they'll get to a place where they say, well, I have a lot of resentment, actually.
Mm.
I'm working my butt off. I'm taking care of the kids. I have a full-time career, and I can't just like go, okay, yeah, I'm ready, because I'm actually annoyed with you that I've worked my butt off all week and you didn't. Or whatever it is. Like there's some sort of discrepancy in the fairness of how they're doing their life.
Mm-hmm.
So if there's resentment, or you feel like you're more in a parent role than you are in a intimate partner role, those are big, that's big, like breaks right
Yeah.
there.
Yeah. Someone just said true to all
Little,
that.
these are,
You know, I'm sorry. Go ahead. Go ahead.
those are not little things.
Yeah.
You have to be willing to look at that and say, yeah, that is actually interfering with me wanting to, kind of dial into my intimate, sexual, sensual self, and look at you as a sexual partner and share myself like that.
Yeah.
That's going to interfere.
What I'm taking from what you're saying, Anita, is that first of all, everything is nothing is
Correct.
abnormal, right? It's sort of where you are in this moment in time,
Mm-hmm.
and everything's up for discussion.
Mm-hmm.
Um, and also, I think you're bringing attention to the fact that perimenopause is a perfect opportunity, if you will, to sort of reassess or maybe look at for the first time what's working for you and what's not. Our 20-year-old selves in every way is
Yeah.
not the same as
Yeah.
our late 30, early 40-year-old
Yeah.
selves. And where our focus has largely been outside of us. And
Yes.
by 40, we may be pretty exhausted and now feeling the physical impact of fluctuating
Yeah.
hormones. Um, I want to get to this question let me just get to it now and then I'll turn back to mine. Somebody asks, how about the only symptom is low libido and weight gain, although with diet and exercise?
That's very common. And part of that can be hormone related. It can be the fluctuation in hormones. And I find, some women, and this might not be a popular thing in the medical community, but I find in my clinical practice, what I observe is that women in perimenopause develop this metabolic syndrome of menopause. And almost all of those women have a low testosterone. They have lots of estrogen. It's cycling properly. They have their progesterone, but they do not have testosterone. And they are noticing low libido or low sensation, or it takes longer to have an orgasm, or it's not as strong, and their fasting glucose is higher, or they're gaining weight without changing anything. Well, you are, because your body is changing.
Mm-hmm.
Inside, how much muscle mass you have is changing. How well the hamster wheel is going around of your metabolism is changing. So part of that's hormone related. Part of it is lifestyle related. There's so many things that influence your desire, right? It's very multifaceted. It is never one thing. So yes, that plays a role. But if I said, and any time that I prescribe any hormones to women, I tell them this is going to help to the effect, the amount that not having it is creating this circumstance.
Say that again.
This
Explain that.
this hormone therapy will help, but only to the extent that not having it is creating this situation. Okay. So it's going to help for sure, but it's not everything that contributes to your low desire. So it'll certainly take care of the part of low desire that, hormone fluctuation is responsible for, or low testosterone is responsible for, or, pain with intimacy and vaginal estrogen is responsible for. It's going to take care of that part. But all of the other things that affect low libido, desire, however you want to say it, are still there, and they're still putting the brakes on.
Fantastic.
So you have to be curious. You have to be willing to look at those things and say, okay, how do I treat myself? How do I put myself first? How do I take care of my needs? How do I meet myself again for the first time as a different sexual being, as a different sensual being? I am not who I was at 20. I'm not even who I was at 30. I'm so much better. And I might like things differently. And maybe my body responds differently now. And so you've got to be so open and so curious about what does that look like, and have a partner who you can share that with. I know we've known each other for 20 years, and I know that worked for the first 10 years, but guess what? My body's changing. I tell women all the time, blame it on me.
Mm-hmm.
You got to go change things up and see how your body will respond if you do this. See if it'll respond if you do that. Get curious, have fun, and see where you get.
I so appreciate you're using the word curiosity. I think that kind of can crack things
Yeah.
open in a new way, and it sort of allows you to be observational and introspective at the same time, and just try something new.
Right.
Give us some tips for that, though, because for some people it might be like, I don't know what's going on. I just don't feel like having sex, and this is really frustrating, and or it's painful, and or my husband is just on my nerves. Like, how do you
Sure.
start to become curious about pleasure and joy and bringing it into the
Yep.
bedroom?
So this is a process of self-discovery, right? And you might need a timeout. You might need to get out from under the pressure of performing, making yourself available to your partner to do something be available for their needs, but not yours. So you might just need a timeout. You might just, I'm going to take a month, and in that month, I'm going to really heal my body. I'm going to see an expert that can help me with my vaginal dryness or pain. I'm going to do some education for myself. And I'm going to, read Emily Nagoski's book, Come As You Are. Ooh, what a great book.
Yeah.
We should just send that out to every
Yes.
40-year-old woman.
I'm so glad you brought that up. Yeah.
So, get invested in yourself. No one's going to do this for you. You have to do it. Right. So maybe you need a timeout. Maybe you need just to declare. I mean, if it was something else, if you were going to run a marathon, you'd be like, listen, fam, I'm going to run a marathon. It's going to take me 6 months to train for it, or 5 months to train for it. I'm going to be at the gym 3 days a week, and I'm going to do a long week on the weekend, and blah, 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 blah. You'd have it all done. And
That's a great point.
you would make time for it. They would support you, all things. So maybe you just need a time out. No expectations. You're going to take care of yourself. You're going to some specialists, you're going to take care of the pain, and then you're going to get into, okay, what is blocking me from intimacy? And it's going to get real, going to get real. You know, you're going to, maybe there's underlying trauma that you haven't dealt with that's starting to
Yeah.
bubble stage of your life. You just have to be so compassionate and so curious. And if you find that's true, you get yourself to a professional that can help you. But give yourself that time.
Yeah, thank you for that. That came up a lot in the conversations I was having this week as well. And I think what it always comes down to is this mind body connection, for lack of a better term. And again, the opportunity that perimenopause presents you to not shy away any longer from all the things that you want, deserve, desire, giving attention to yourself.
Yeah.
So I love that you suggest a timeout and
Yeah.
kind of equate it to training for a marathon. Like, it's true. If you made that decision, the amount of attention you would give yourself to that particular goal would, and everyone would stand out of the way and support it, right? And this, go ahead.
They'd cheer you along. Come
Yeah,
on.
yeah.
They'd absolutely cheer you along.
Um, Switching gears for a second,
Sure.
someone commented here, I still go through really bad PMS, even though I'm on the estrogen patch and progesterone. I'm still in perimenopause. Is the bad PMS normal?
It is normal because your hormones are still fluctuating. It's a delta. You know, your hormones are here and then they're going to go to here. When you add a little bit of estrogen and progesterone, and I don't know if she's cycling it, it's only days like 14 to 28 or 21 to 28. A little bit of estrogen is like, okay, we're just going to keep you here so you're not completely bottomed out the whole time. But it's not going to be the same as like your estrogen can get like way up here when you ovulate, right? And then it goes way down to the bottom. So it's not going to stop that. You're still going to have, you're just not going to go completely rock bottom. So that helps, but you're still going to fluctuate. You're still going to feel the fluctuation of hormones.
Yeah,
And so that's
thank you.
where you have to get so diligent with all the other things.
Yeah,
If it's
yeah,
going through here, is it nourishing your body? Is it good on a cellular level? Like, you have to really get good about what are you putting in your body? What are you putting in your mind? Is it kind? Is it healthy? Are you exercising? Are you taking time for yourself? Are you your own priority? Because you've got to get so clean with all those things because it is not an easy time to go through. It is not an easy time. And we should be prepping women kind of like how we do for young girls when they're going to approach their period or
mm-hmm.
who are trying to get pregnant. We do all this support and love. Here's 5 books and, I'll help you through it. Call me. And, perimenopause is, we should be saying that, listen, it's hard. You're going to be in the trenches for a little bit. And there's some things we can do and we can be very proactive. But girl, you got to get good with yourself in all the places. You can get
I
strong.
love that.
You get strong in your mind. You get like,
Get strong in your
and
mind, get strong in your body, get strong on your plate, get strong in the gym.
spiritually,
Yeah,
get
yes.
good with yourself and take the time. And by this time, you've earned it. Not that it isn't your birthright, it is, but trust me, you've made enough sacrifices in your life that you can carve out this time for yourself. You are entitled to it, honestly. You should be having no problem at this point saying, yeah, that's not going to work because that's my time. So what else can we look at?
Do you all
Like,
see why I love Anita?
boundaries. You got to get so good. You know who I really love with boundaries is Terry Cole. Oh, that woman is so great at boundaries. She wrote a book called Boundary Boss. Oh,
Okay. Boundary what? You
my
cut out. Boundary boss. All right, everybody take note. I have another question for you, Anita. What if I had a hysterectomy because of endometriosis? I'm
God.
getting all the full menopause symptoms. What are her options?
Well, she should see someone who specializes in
Yeah,
menopause.
thank you.
Yeah,
you. And might
yeah.
I slip in and add that truly, truly, I say it all the time. It is not across the airwaves enough. A platform like ours, the work that Anita does,
Hmm.
menopause specialists are what you need. They are the people that
Yeah,
you need to be speaking with. They understand the hormones. They understand where you've been, where you're going, and how to best support
yeah,
you today.
yeah, yeah. And that menopause expert is going to have that nuanced conversation with you, is going to do a full workup with you. And we understand that hormones are all over the place all through your cycle, right? You can take them and understand, like, well, that's where they were that day that you had them. Sometimes it's informative, sometimes it isn't. And sometimes it's trial and error of what you're going to try to see if we add a little bit of this, does it help? Does it help on
Right.
the case? If you know, so you have to have a provider who is so good and engaged and has experience with that exactly, and that is going to be someone who's an expert in menopause.
Yeah,
Yeah,
thank you. Thank you for
that's
that.
that.
There's another question that came in, the Zydus patch. She says she started having neuropathy issues when she changed to this patch for a week. Took about 3 months of being on her old patch to start feeling better. Any thought on that?
I mean, that sounds like a medication
Yeah.
reaction. Yeah. And like you have to remember every time you try something new, your body can say, no, thank you. No, thank you. I don't like that. I don't like the adhesive. I
Yeah.
don't like the ingredient that like is helps with the delivery mechanism. I don't like, yeah. So there's always when you start something, you have to be on the alert for,
Thank
you
you
know,
for saying that as well. And that's another thing that I always will remind people, that the options are there and you are allowed. It is totally normal to not like how you're feeling on this dose or this
Mhm.
mechanism, and others
Yes.
exist, and there the options are endless.
So many
What
options.
right?
Right.
um Somebody, I just want to let you know that somebody says, as an NP myself, I'm learning so much. Thank you
Oh,
for being here.
awesome.
Um,
So
I, I, I want to, I know that we're close to time, Anita. Um, this has been a terrific conversation because there are these sort of, we are um, there are many parts of us, right? And there's this sort of holistic look into how we find joy, how we find pleasure, how we find health, how we experience longevity. And you've really kind of parsed out what all those pieces are and how important it is that we um, be introspective in order to kind of show up in the world well. Have I missed anything that you'd really want to kind of leave us with today?
no, I mean, this is the kind of discussion that we already know we need to have another one, right?
Yes, yes.
Oh, we need to like wiggle down into that topic a little bit more.
And
Um,
we are
yes,
having another one next month. Yeah.
right. Yay. I think one thing that women can do in perimenopause is learn how to prioritize themselves because they have probably, and I'm not every woman, I'm just saying probably 75% of my women who are in perimenopause have prioritized everyone else in their life up to then, right? And they're overtaxed and overcommitted and all those things, and it's away from their own selves. So it is a time where you need to prioritize yourself. The end.
That's so awesome. Anita, people are asking where you are. Could you tell us how to find you?
Sure, sure. You can find me on Instagram on menopause underscore HWell FNP. I'm there. I have an office in Maine, in Portland, Maine. So you can find me here in New England.
Awesome. Thank you. I just love Anita, and I
Oh,
couldn't wait to speak. She's like a buoy in the ocean. You know, she just says, "You've got this. Let's get you straight up and carry on."
oh yeah.
Every single time. She's a fierce advocate for all of us, and I'm so happy to bring you to the Alloy platform. I can't wait to speak with you again next month.
So
Um,
here.
thank you. Thank you, everyone who came. Go ahead.
It's amazing what women can do when you support them.
Yes.
Yes.
Yes. It,
We
it,
need to put our little crowns on our head.
yes. 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 Balance that crown and carry on. You can do it. You can do
Yeah.
it. Thank you so much, Anita Nicholson. Absolute pleasure to speak with you. Thank you, everybody who came today. So happy to see all of you. And we'll see you next month.
See you next.
Bye, everyone.
Bye.
Thank you.